Welcome to Biohacking for the Executive Athlete, where high performance meets deep recovery and ambition is powered by coherence. I'm your host, Nicole Ward, Senior Vice President of Sales at Aon, board-certified health and nutrition coach, wellness geek, biohacker, and founder of the Sales Athlete platform. Each week, I get to sit down with industry leaders, elite performers, and trailblazing biohackers to uncover the science, strategies, and daily practices that fuel sustained success at the top. It's not just about pushing harder, it's about recovering smarter, thinking sharper, and performing better. Our energy is our edge, and this is your playbook for high performance from the inside out. In today's episode, we're venturing into a space where aesthetics meets longevity science. I'm joined by Dr. Goretti Ho Taghva, a renowned plastic surgeon who's redefining beauty as a pillar of performance, not vanity. This conversation bridges biohacking, regenerative medicine, and executive presence, revealing how looking our best can actually help us lead our best. Dr. Goretti Taghva is an award-winning board-certified plastic surgeon and founder of LEA Plastic Surgery and Aesthetic Lab in Newport Beach, California. A graduate of Brown University and the University of Southern California's prestigious plastic surgery residency program, Dr. Taghva is internationally recognized for her pioneering work in ethnic facial plastic surgery, deep plane facelifts, and next-generation breast and body rejuvenation. Known as one of the first U.S. surgeons to integrate endoscopic, minimally invasive techniques with biohacking-inspired approaches, she delivers dramatic yet natural results while minimizing downtime. She's also an early adopter of fat transfer for facial and breast augmentation, offering patients a regenerative, filler and implant-free path to timeless beauty. Her innovation and artistry have earned her repeated honors as a Real Self top doctor, inclusion on the Southern California Super Doctors list, and recognition by Orange Coast Magazine's Top Doctors. Nationally, she contributes to the field through the American Society of Plastic Surgeons expert panel on eyelid surgery and is a volunteer faculty training future surgeons at USC. At her boutique Newport Beach practice, Dr. Taghva blends aesthetic surgery, longevity science, and cutting-edge non-surgical technologies to create a 360-degree approach to beauty, wellness, and confidence. Her philosophy: true aesthetic excellence isn't just about looking younger, it's about optimizing how we feel, age, and thrive. Dr. Taghva, thank you so much for being here, and I'm so excited for this conversation today.
Thank you, Nicole. I'm honored to be here too.
Absolutely. Well, I thought we might be able to open and touch a little bit on a bit of your origin story. Mm-hmm. How did you come to be a plastic surgeon? Did you always know being a doctor was going to be in the cards for you, or tell us a little bit about that?
So I grew up in a family where they're all business people. I'm the first doctor in the family. I grew up in Hong Kong. I went through a pretty circuitous route. I went to boarding school on the East Coast, extremely competitive. Then I went to Brown. I've always thought I want to be, an internal medical doctor, does tropical medicine. At the time, HIV was still an epidemic, and I thought I would be doing a lot of research on that. But then when I was in my 20s, I actually I went to different countries like Ghana, India, and I did some medical mission there. And I realized, they don't have labs, they don't have medication. So as an internal medical doctor, I couldn't really do much. So I started shadowing some doctors there. And if anything, I was shadowing orthopedic surgeons, OBGYNs, and I thought, surgery was so much more fascinating and you can actually do something to help. So when I got back, when I was deciding what field to get into, I started looking at different surgical subspecialties, and plastic surgery really fascinated me. You can operate from head to toe. There's no limit. It's not always the same operation day in, day out. And I grew up, I met a lot of good mentors. And so that's how I got into plastics.
Fascinating. Well, one of the reasons why I met you years ago, one of the many, was because you're known not just as a surgeon, but you're a doctor that bridges aesthetics and wellness with a very holistic approach, which always resonated with me. How have you come to see sort of plastic surgery and regenerative medicine and longevity science as part of the same conversation?
Yeah, so I'm in now, I'm almost like 14 years into my practice, and I am a pretty conscientious surgeon. Like, I always look at my surgical outcomes, I try to do better. And I realize I used to beat myself up if someone doesn't look as good as I thought she would look, like after a facelift, after eyelid surgery. But then I grew to realize, a lot of it has to do with things that I can't control. So if someone is metabolically healthy, if they're hormonally balanced, if they get enough sleep, they exercise, those patients tend to do really well. And the surgical outcome, the result kind of lasts for years to come. Whereas some people, I can do the best lift on them. They look great for the first few years. And then 5 years later, when I see them again, they just don't look as refreshed. And part of it is maybe they drink too much, they smoke, or they don't really take care of themselves other ways, right? And so I realized, what, as a plastic surgeon, as a doctor, it's my duty to kind of look at the whole big picture and kind of guide my patients through other, lifestyle changes too, as well as other regenerative, medicine that is pretty popular now, like peptides and all those. I try to educate myself and learn more about those things too and incorporate it into my practice.
I think that's such a great call out because it's an inside-outside thing,
Right.
not just an outside thing. And there is some accountability on us, like you say, to do all the good work, right? All the inner work. I know that many executives and folks in our audience might dismiss plastic surgery as something that's vanity-driven or vanity-based. Why do you think, or what are your thoughts on how leaders could start thinking differently when it comes to things that are aesthetic related?
Yeah, so historically, I think my field is perceived as more, of a vanity project. But I really think, especially for executives and leaders, you have to see, your appearance as part of, the whole strategic presence, right? I know people invest in public speaking or a fancy wardrobe before an executive event, but I think the appearance is part of the whole toolbox, is equally important, if not more. Because if you look at, there's so many psychological studies, social science studies that talk about how the first impression really matters so much. I mean, my favorite is, Daniel Kahneman, Fast and Slow Thinking. I don't know if you read that book.
It's an excellent book.
And so, the fast thinking, the system one thinking really matters so much more than people think. Everything is judged within milliseconds, right? And so as an executive, if you look tired, if you look, not energetic, or it really hurts. I think it matters. It's not about looking like 20 years younger, like most people think, but it's really kind of giving you that vitality that matches the outside with the inside. Because the last thing you want is you could be the most capable executive, but if you come out looking tired or disheveled, people don't take you as seriously.
I think that's such a great point. And, for those of us that are really committed to health span and living a long life,
Yes.
And working arguably longer than folks, our parents or grandparents did,
Sure.
There is, I think, a matter of staying, doing our best, leading with our best.
Yes.
And I think, an overhaul is different than refreshing, right?
For sure.
So I think that's such a great call out. And speaking of health span, in biohacking, the focus is often on, longevity, not just lifespan, but living the best that we can for as long as we can. How do you think aesthetic medicine supports or could support not just extending how long we live, but how long we lead with that vitality. When people think about this, it's similar probably to what I just shared, but like, I'd love your thoughts on that.
Mm-hmm. Yes, I'm very into longevity medicine. I probably read all the books out there about it. And the truth is, you're right, we're living longer. But I don't want to live longer and be, non-functional or looking all, shriveled up, right? Like, I want to look as good as possible for as long as possible. So a lot of the what is available right now, I think it's great. It's really about nutrition, diet, exercise is so important. And supplements out there, there's so many of them, right? But at the end of the day, you have to look at our appearance, our skin as like an organ, right?
Mm-hmm.
Skin is really the biggest organ in our body. And there are not a lot of things that target that specifically. Like, yes, we take supplements, but not a lot. We don't know where it really targets or where it goes. But a lot of the non-surgical tools right now, for example, are like energy-based devices, biostimulators. Those things are really targeted to rejuvenating the skin. And a lot of times, obviously, people come to see me, they are like, you know what, I want to do things, but I don't want surgery. And energy-based devices, I always tell them, don't expect them to do what surgeries do, right? It doesn't really lift the way you would want, like if you were to get a facelift. But a lot of it is really preventative. So we lose collagen, starting in our late 20s, 1% a year, right? And you don't really notice that difference in your 30s, but in your 40s, like I'm in my mid 40s, I notice it now, right? Because it's a cumulative loss. And so you want to kind of take care of it sooner rather than later. You want to, do those non-surgical treatments, start a little, not in your teens or 20s, but maybe in your 30s. It's time to consider doing those energy-based devices or biostimulators just to kind of, counteract that collagen loss.
Mm-hmm.
So a lot of the tools we have, you're right, historically is being seen as, just women being vain and wanting to look like a 20-something. But it's really not. A lot of it is really, you want to kind of maintain that skin health earlier before aging truly kicks in.
I think that's such great insight. And, if you were to have someone come to you that said, look, I'm 50 years old, I'm thinking about, doing something.
Mm-hmm.
I want to look as natural as possible. How do you coach someone on what's just enough? Like, that balance between looking very obvious that you've had something done versus that subtle refreshment that you mentioned. How do you guide people on, that fine line, that balance between the two?
Yes, and that fine line is what's so important to me, especially because in the last decade, I feel like things have kind of gone awry in my field. I think everything became, you have to be kind of extreme to be viral to get the attention of the general public, right?
Interesting, yeah.
But my philosophy is always, you want to look refreshed, I call it subtle science. You want to look subtle, not loud and exaggerated. And so I think patients who are attracted to my practice value that. They might not find me on Instagram, but it's really word of mouth because I really value that natural aspect of it. And so, for example, Botox, let's say Botox, right? My practice is in Newport. So the popular thing to do is to freeze everything, right? I don't believe in that because I feel like a frozen look, once you tip over to looking at natural, it actually ages people. Because you see young people doing a lot of fillers and Botox. Sometimes when they walk in, I would think they're much older than their
It has the opposite effect,
age.
right?
It
I've
has the
seen
opposite
that
effect.
where I'm like, wow.
Right.
It's a bit dated, right?
Yes. And so I think the fine balance is you don't want no result either. And so it's really obviously artistic perception on my part. But the thing is, there are so many diagnostic tools now that can really guide the treatments too.
Mm.
So in my office, I really utilizes especially this year, I start utilizing the AI powered facial analysis tool that keeps track of every matrix, like how many fine lines you have, pore size, pigments, and if I always think you can't really optimize what you can't measure, kind of like our Oura rings, eat,
Right.
sleep, all those things, right? So in my aesthetic practice, I try to frame it in such a way that everything we do can be measured as much as we can. And so I think that goes back to how I guide a patient who comes into my office. I really start with all those diagnostic tools now, and then follow the results 6 months, a year later, and see what improvements we get, what don't we get, and then work from there.
Yeah, I wonder, it's wonderful that you use AI to that degree. I think that's super interesting. And can you say more about some of the tools, like, for example, what AI, the feedback after using that diagnostic tool, based on certain feedback, you might do one thing or recommend one thing to one patient,
Yes.
or say, oh no, based on this diagnostic, actually this would be better. Can you give a little example of that? Because that's
Yes.
fascinating.
So one of the big investments I made this year is I purchased a AI powered facial analysis 3D scan. It's actually from Korea. And I've done a lot of research, and I picked that one because I think the data it gives you is really comprehensive. So it shows you, pigments and fine lines and pore size and, skin health, skin conditions of every kind, really, after I think 10, 15-second scan. And then on the plastic surgery side, it also guides me with, different facial proportions, what is considered, the beauty ratio, and how far off is a patient from that. Obviously, it's quantified based on ethnicity and all that, but it kind of gives you a framework. It doesn't mean I have to follow it to a T and everyone has the perfect golden ratio, but it provides me, a lot of framework that I didn't have it before. It used to be just me looking at a patient and I think artistically I should do this and that. But yes, patients look better, but there's nothing I can quantify. Now I do.
That is a fascinating tool. I mean, I can only imagine having that as a backstop, supporting what is obviously already a very successful practice and artistry that you have on your own. But that could be, I can imagine, really powerful.
Yes, because I personally, I'm sure like you too, I'm obsessed with data now. Everything I buy, it's for my sleep, for nutrition, for everything. I want to quantify it, right? So I feel like, how come my practice didn't have that? I just feel like it's really time to up my game in my practice too.
That's fantastic. Well, and it's, in biohacking, we say it's just about tightening the feedback loops, right? We're trying to, like you say, get at the data and that's meaningful, measure it, and then pivot, right? That's fantastic. People have so many options out there. There are the biostimulators that you mentioned. There's things like Sculptra. There's, surgeries and tightening devices. How do people, I know you obviously, have a tool that's helpful and you have a discerning, obviously capability, but how do people really know, what's right for them? I mean, seeking, advice from someone like yourself, of course, but it feels like there's so many options, so many different kinds of lasers, how do we make sense of that, right?
I know, and there are more to come, right? And so I think a lot of it really depends on something objective like the diagnostic tool that I talked about, but a lot of it also comes back to your lifestyle, what your goal is, right? So for example, I saw a patient yesterday and she was like, she was like a high power, executive, but she's retiring in a year. And she was like, I'm not trying to look 20 years younger. I just want to upkeep. I just want to look as good as I can be. but natural, right? So, but she doesn't have a lot of downtime. So what I recommended is, microdosing Botox, something like therapy or thermage where there's zero downtime. Honestly, you do the treatment and it doesn't look like you did anything the next day. So those things are perfect for her because she can't take time off work. And then, like I said, peptides, sometimes I incorporate it to my non-surgical and surgical procedures as well. Those things, I see it more as regenerative. So there's no outward, downtime, or there's no impressive before and after, but it's really a long-term strategy. So everyone is different. If someone has a little bit more downtime and they really have a lot of pigments or fine lines that they want to target, then I would make them do more like BBL Moxie or sometimes even CO2 laser if they can afford the downtime for more comprehensive, skin resurfacing.
I remember one of the things years ago when I first came to you, you were exhaustive in your questioning. And I remember how much time you took to spend with me, really asking me some of the really penetrating goal questions,
Yes.
like what I was trying to accomplish. And I remember you asking me so many of those questions, and it was incredibly helpful because it made me think of things that I had not considered
Right.
or weighed into, things like downtime. Like,
Yes.
what can you afford from a downtime perspective?
Right.
What can you tolerate, looking at yourself in the mirror with?
Yes.
Because, a CO2 laser is, it's tough,
It's tough. I know.
So,
Yes.
so I think you were so deep and thoughtful on the questions that you asked, that it made my experience that much more meaningful and on target and customized.
Right. And that is so important, especially these days, right? Because you have social media where everyone look at some celebrity who did, supposedly some kind of facial procedure, and then they look great. You don't see the downtime. You don't see how much they suffered. So people just automatically assume, like, if you do something, then you will look like that, right? But so they come in with like a unrealistic expectation too. So by talking to them, you kind of slowly guide them to, bring them back to earth a little bit and kind of give them different options, right? I show them pictures of recovery, not to scare them from doing surgery, but I want them to understand, okay, well, I'm going to look like that and it's normal, right? I don't want them to go home thinking, how come I don't look like that celebrity right away? It's not because I did something wrong, it's because they don't show you that side of it.
Right.
So I think re-educating the expectation is very important in my practice, especially with ChatGPT and social media.
Right. I wonder, well, maybe we could switch to men for a second here because there are a lot of male executives out there. And I wonder, are there things that men should think about or that maybe they tend to overlook because they feel like, oh no, that's for women?
Yes.
I would love to hear your thoughts on that.
Yes, I think that is the most common thing. I mean, even my husband, like, he would not even get Botox or anything. I have all these skincare products that I gift him. I don't think he has ever touched it, right? I mean, he has good genes and he looks great. But at the same time, I think men used to think it's a very feminine quality to seek help in this regard. But the truth is, in my practice, I see more and more men every year. So I think men are definitely more educated about that too. And the truth is, the tools are all out there. Why don't you use it to help yourself look better, right? And a lot of those tools are really, for men, is their skin is heavier, it's thicker, their pores are larger, they have deeper, wrinkles. Those things can be targeted, not to make them look like they're a teenager again, but you want to slow it down at least. So a lot of the tools that are great for men are, very judicious, Botox use. You don't freeze them because I think men without expressions look strange. But even a medical facial, it's, it offers so many benefits for men to, cut down the inflammation on their skin. So those things kind of slow down aging in general. Or therapy, thermage, all those things have zero downtime, but it stimulates collagen growth, right? Biostimulators are great because you don't look unnatural. You don't look like, men are always scared of, I don't want the duck lips and all those things. But the truth is Sculptra, PRF and all those don't really give you that waxy fake appearance. So those things are great for men too. And for me, for my practice, the technology that I introduced last year is called Folix, which is a hair regeneration laser. That actually is very popular amongst my male clients because they obviously losing hair is traumatic for everyone, but especially men.
Sure.
So that is something that I don't know if a lot of men knows about it, but it's a very good laser for hair growth.
And so can you say more about the particular one that you have and how you selected that one versus, because I think there's a lot of devices out there now currently, right? That there's the red light, and that.
Yes.
But how is Folix sort of exceptional?
So Folix is really the first equipment, laser in that category that targets hair growth. There were machines in, the last decade that claims that it can grow hair, but then a lot of them involves some kind of serum injection. So it's not just the laser, This one is really just the laser. Obviously, I want my patients to have the best results, so I combine it with, growth factors and vitamins and all that to optimize everything. But the laser itself has very good white papers that show that it does a lot of, it shows results. So far I've had it for 9 months or so. The before and afters were pretty impressive because I used to do PRP injections. But the problem with that is some patients do get good results, but others don't really show much. And part of it, I think, is because it really depends on the quality of your blood. So if you're older, less healthy, the quality of the growth factors are not as good. So there's less of it's not as consistent.
Yeah. Interesting. And, I know you stay on top of everything going on, in your field when it comes to innovations and, really exciting technology. What's exciting you the most right now? Like what innovations are out there that you've glimpsed when you've at conferences or speaking or talking to other leading plastic surgeons?
I think the most exciting thing right now is we're moving away, from carpentry, lifting, cutting, deep plane and lifting, different planes for, surgeries to more like regenerative medicine. So even in my facelift now, I try to, incorporate that. So there's more of a longevity aspect to it as opposed to I'm just doing carpentry, So that is exciting. I honestly think because of AI, there are a lot of AI generated, images out there. And we went through the last decade where everything is so exaggerated. I have a strong feeling, and part of me is my optimism. I hope that we are going back to the opposite. We're going back to more natural results. So a lot of that, I feel like for surgery, a lot of the endoscopic techniques that I use, I feel like it's going to be the future of plastic surgery too. Because I think most people don't want the big cuts, huge incisions. They really want minimal invasive, small hidden incisions, and have like a natural lift. Maybe it's not like, super wind tunnel, crazy tight, but it makes you look at least 15, 20 years younger with small incisions. That, I think, surgically will be the future. In terms of devices, it keeps getting better. I mean, every year, there are more new technology that really targets new collagen growth, natural volume augmentation, instead of using chemicals. to plump up your face. The goal is not to plump it up anymore, but really to go back to neutral, right? Replenish what you lost as opposed to looking exaggerated. But my point with the AI imaging just now is I think you see more AI generated images now. And there's something I read, it's called uncanny valley effect. So basically, when things look too human or too perfect to a certain point, it actually, people don't trust it as much. They see it as less authentic. And so I think now maybe it's time to move back to looking more human and looking more natural. And so that, I think, honestly, it's a trend that I can't wait to see.
Well, and it sounds like you're at the forefront of it, right?
Yes.
That sort of connection of regenerative medicine and plastic surgery and all of the, the health and the wellness underneath, right? All kind of coming together, right?
Yes.
I know when we think about all of our devices, right? I'm a huge fan of, as a biohacker, I'm a huge fan of devices. And as we were saying, feedback loops. I think when we have all of the, you've got their DNA, their lab work, their history in terms of what they've had done. And when you combine that overview of all the things, you have a whole patient and you're treating that whole, right?
Yes.
Not just a thing. And I think that's a wonderful approach. I love that. If you could give the audience some advice about aging well inside and out, you see people, all along the spectrum of the lifeline, what would be some advice that you would give folks about heading into their years in the best way possible?
Yes, and I'm aging myself, so I really believe in aging intentionally. I know it sounds really cheesy, but don't let, age just drift by. Unlike our grandparents, my grandparents' generation, where there really was nothing to do. So you kind of take it, okay, now I'm in my 50s, 60s, I have to look like an old person and dress like one. I see the evolution with my mom's generation. My mom, even till this day, she's almost 70. She looks great. She's young, she's still doing exercise, dress nicely, take care of her skin and all that. So I feel like really, especially now in my generation now, there's so many tools out there. If you don't use it, it's kind of stupid at this point. Like you have to utilize what's available. Obviously safely, right?
Right.
You don't want to, because you don't want to abuse it. Everything in moderation is important. You don't want to become, you have developed body dysmorphic, disorder just by obsessing with aging too. I think it's okay to age. It's great. I'd rather age than the alternative, right?
Yes.
At the same time, I want to live long. I want to be able to see my kids, my grandkids, and all that. And so I want to be functional. I want to still be confident when I'm older. And I think a lot of the non-surgicals, as well as, surgeries are important because surgeries can fix things that nothing else can. It's really a structural problem. And even with AI in the future, there are structural problems that none of the non-surgicals can fix. And so that is when, don't rule out surgery either.
Right.
I think it will be less stigmatized moving forward.
Yeah, knowing the time, and seeking, a great resource like yourself to help guide you through the asking yourself the right questions when you're ready for it, etc. I think that's great. Any last insights that you want to share? Anything I should have asked you that I haven't yet?
I think you asked me almost everything, but I really think as a plastic surgeon, I don't really do a lot of, social media, viral videos. But I really think everyone has to be, well-informed before they jump into a trend or like a TikTok trend that is harmful to people. I really think, see a professional, see, board-certified doctor or surgeon to guide you with all those treatments. The problem with, there are a lot of med spas popping up left and right, and I feel like I see a lot of patients having, they lost trust in the system because they got botched, or they think, they make videos and say whatever treatment is harmful, when in reality, they just didn't really go to the right person. So a lot of that, I feel like people need to be more educated and do the due diligence and seek out professional, help.
Yeah, I think that's good counsel. Absolutely. Good. And if people want to find you and follow you, I know you're Unreal Self, but like any other ways that people can find you?
So on Instagram, it would be LEA Plastic Surgery.
Okay.
My aesthetic longevity lab, it's called LEA Aesthetic Lab.
Okay.
LEA, actually, they are initials of my 3 daughters.
Aww.
Because my name is too hard to pronounce. So I don't think it's, so I use their initials.
I love that. I didn't know that after all these years. Well, as someone who has been your client for many years and had the opportunity to work with you and love my results every step of the way, I really appreciate your approach. The 360-degree customized, thoughtful, holistic approach you take, I'm a testament to and have absolutely benefited from. So it's been an incredible experience working with you and getting to know you and your team, who are amazing. It makes the drive from LA all the way to Orange County worth it. You do.
Thank you. I know. I appreciate that, especially after today.
Absolutely. Thanks again so much for being here. This was wonderful and super insightful. Thanks so much.
Thank you.